the Rogers TV viewer response line. Email us or connect with us on social media.
Going to get very hard. You're going to see things from Nicole never seen before.
I want to make a list. I'd like to write letters to the girls for certain milestones in their lives. I want to have blue hair.
Molly, will you tell me when it's happening?
It's not happening. And I want to sing on stage with Katy Perry.
It all seems pretty doable.
Does it?
Hello and welcome to the special edition COVID-19 Rogers television program. My name is Carol Merton, and before I welcome our guest today, for those of you who watch the program, you know that I like to say a few words at the beginning. On Thursday, January 2021, as part of the declaration of a second provincial emergency, a stay-at-home order was issued. This order and other new and existing public health restrictions are aimed at limiting people's mobility and reducing the number of daily contacts with those outside the immediate household. We are all now on the front line. We are all working together to stop this virus from spreading, since the virus will seek every opportunity it can find to spread by finding loopholes. Let's not give it that chance. If you wonder whether what you are planning to do meets the restrictions outlined by the government, check first with the experts at the health unit. When in doubt, check it out before you proceed. There is no doubt that this is hard work for all of us. It is hard to be isolated and to have our daily routines disrupted. We are all weary, and those essential workers in healthcare and long-term care settings, public health, first responders, our businesses and pharmacies, and so many others need our support now more than ever as we move through this pandemic. Never underestimate the value and importance of what you are doing by following the public health unit guidelines. The sacrifices that you are making each and every day, these sacrifices are helping to prevent the spread of COVID-19 to those who are most vulnerable and to those that you hold near and dear. You are saving lives. So thank you, and I also wish to thank Dr. Ian Arra, who has joined us today on the program. Dr. Arra, it's always a pleasure to speak to you, and I know you're going to be talking about the Grey Bruce Health Unit's plans, where we are currently with the COVID-19 statistics, and of course, as everyone wants to know, where we are in relation to vaccines and the vaccination clinics. So thank you for being here today.
Thank you, Carol, for having me. Always a pleasure.
Thank you. So take us through where we are in our current situation at this point in time.
Yeah, so we do continue to have full control over the outbreak in Grey and Bruce, and that's really directly related to the heavy lifting that everybody has been doing. As you rightly said, it's a sacrifice. It's not an easy one for 10 months at end, and to follow something we're not used to, like changing our habits. We're a creature of habits, and changing things, being away from our loved ones, it is not easy. But if we remember, like you said exactly, if we remember, this is saving lives. This sacrifice would become not just a burden, it becomes enjoyment. It's exactly the opposite. We are contributing, all of us, to the work that the healthcare providers are doing in the hospitals. And people talk about the lockdown and is it necessary for Grey Bruce? The school was closed. Is it necessary? and it is definitely necessary. If we go back just in the numbers from December, November, and December, our numbers were trending down the right way, based on the response from the communities in Grey Bruce. And we know around the holidays, we expected people will get together, and we recommended against it. And I know many people didn't, some people did. We saw the surge reflecting that getting together, that family and friends gathering. Most of the cases that we've seen in January are related to these gatherings. So that's another evidence that actually the recipe works. As long as we keep the 3 W's, the distance and hand washing and wearing a mask, we can control this pandemic. From that point of view, if we go at December, our major concern was if we have the good numbers that we had and other parts of the province don't, we will find ourselves turned into a magnet where people would come here to use our restaurants or use the personal service settings, hairdressers, or do shopping. And the bulk of my work and my team's work in December was how can we mitigate that? So the lockdown came in, and it was a perfect solution, not just for the province. For Grey Bruce, it was a perfect solution. For the province, it is still, in the work to show the results, and I have no doubt it will show the results. So, is it necessary for Grey Bruce? Was it necessary? Yes, it is. For the province, it's not just necessary. I can add many adjectives that would reflect that: important, indispensable, vital, crucial, you name it. And the reason of this importance is the number of cases we've seen in the past 2 weeks in the province, average of 3,000. Even if they taper down right now, they will generate lagging indicators. That's a technical term for it. They will generate hospital admission, ICU admission, and unfortunately death. And that will be generated over 4 to 6 weeks. So we're not out of the woods yet. Even if the lockdown is starting to work provincially, it is important to stay that course. And that's circling back to staying at home. Like you said, it is very beneficial for all of us as one province, as one country, as small community, as a family, that will stay at home, and we're saving lives to help these healthcare workers in hospitals across the province, because we're not on an island on our own. Our hospitals have started receiving patients from other parts of the province. So I thank everybody in Grey Bruce for doing the heavy lifting. I'm sure there are going to be more questions that will touch base on many subjects, including vaccines and others.
Yeah. So your message really is, even as the numbers go down, we need to recognize that we cannot become complacent. It is going to take time to be able to conquer COVID, and that we have to keep this up, not just for Grey Bruce, but also for others as well.
Indeed. And Carol, this becomes even more important knowing that we have the vaccine right now. The solution is around the corner, and losing control of this pandemic at this point is really, it means all the effort we invested has basically not materialized into the solution that is around the corner. There is something about pandemics that is good. You might be surprised to hear that, but there's actually a common denominator to all of them that is good. All of them end, and this pandemic will end as well. And if we do the right thing and we stay the course until the vaccine is in arms, we will end this pandemic way earlier than it would be.
And I really think we need to start using that as a banner, because it's been so long. I've had people say to me, this last year or 9 months, it's felt like 5 years. Like, it just feels like a long time. So knowing it will be over, we just have to hang in there, for sure is important. Let's talk about vaccines.
Well, that is the exciting subject. Honestly, it just brings joy anytime I think about it or I work on it. And I know everybody around the table is doing awesome work. And we are ready in Grey Bruce to mass immunize at a population level. And it's the nature of the situation that the availability of vaccine is not yet here. The criterion in the province is to distribute the vaccine to high-risk areas, and we have been low-risk areas. So we are from that point of view, we are the victim of our own success, if I can say that. Nevertheless, we are ready to receive it and use it as soon as we can. There are two plans, Carol, for vaccine distribution. One of them, we started working on it in August, which is the traditional distribution plan that we use on an annual basis from the health unit to healthcare providers to family physicians. There's a parallel system to the pharmacies. In the pandemic, we will definitely provide pharmacies with vaccine whenever we have them. And this would work for the Moderna vaccine, other types of vaccines that could be mobile. The second type of vaccine requires a different plan, and this plan is a mass immunization hubs. The recovery centers that we have in Grey Bruce, the field hospitals, would make really with simple modification or minimal modification, optimal hubs to vaccinate large number of people, and that's the excitement that in the near immediate future you're going to hear the details about these hubs, and I'm sure it's going to impress. We have put together a task force for Grey Bruce specifically for this second plan, but also it would work for both plans. Part of it is the buy-in from all sectors and the way we can get input into the plan to be modified. For example, I can give you an example. If we're going to get a few thousand people into an arena on one day, we need the support of the police agencies to arrange that traffic control. For people who cannot go to the hub, should we just leave it as so? No, we need to ensure that there is a shuttling service, whether it's a school bus system or the municipal system. So these partners are around the table, healthcare providers, many volunteers put their names forward and their contacts. And together we will be ready in no time to actually receive vaccines whenever they come. The supply is the major issue. There are many ifs around it. There are things that provincial distribution, allocation, or national and international, like we heard recently. There were 3 shipments allotted for Grey Bruce, 1 for next week and 2 for the first 2 weeks in February. Next week is not confirmed anymore and most likely would not happen. We're still cautiously optimistic there are going to be some allocation in the province that might send us, but the confirmation is not there. And those allocation, all these shipments, it's worth mentioning, will be going to long-term care facilities, staff, residents, and caregivers. And we received a modest shipment on January 15th that we distributed into 3 long-term care. We completed 2, and we used whatever left completely in the 3rd long-term care. Carol, I'm going to go on a little detour here, come back to any other question.
Go for it.
When I went into the long-term care that morning on January 15th, my brain is going through the tasks that I need to do and what I need to observe and what I need to direct. And when I walked in through the facility, Mapleview, there is a screening process there. So I'm busy with it. They take my temperature and they do all these things. Then it hit me. There was so much joy in the atmosphere there. It's not the norm. I worked in long-term care before, and there are quiet places. Everybody moves a bit slower, and the pace is as so. And that morning, it was like Christmas party. People were excited. All the staff, all the residents got the vaccine. Almost all the staff didn't. A few didn't, and there could be many reasons. People could be waiting for more reassurance, or could be a scenario where somebody might be planning pregnancy. So anyways, the level of acceptance of the vaccine technically was high, but the joy of that morning, and I have no doubt people who are waiting for the vaccine will get the vaccine in the near future. It's a matter of weeks, maybe months, but it is going to be here with us soon.
I can't imagine how you must have felt when you were there observing that first injection and all of the hard work that you and all of your staff have done. That must have been so rewarding for you. I know when I looked at the images, because the press were there, honestly, I truly felt it in my heart. I thought, this is an amazing moment.
Definitely, and it's not just for myself or my staff. It's everybody around the table, Carol. Like right now, your work right now in this interview is saving lives. I have no doubt about it. I mentioned it before. Providing the information to the public to put it in a timely fashion in their hand, for them to make the decision to protect themselves, their family, and the community, will circle back to allowing the older adults in that long-term care to actually enjoy that moment. If things went the wrong way in the past 10 months and a number of these individuals didn't make it, that vaccination would have been, too late. It would be over, but for the shouting. So again, it's the heavy lifting that everybody around the table contribute to make that day happen.
And we're all part of the team together to be able to celebrate the success as well when we're on, certainly post-COVID. You did say pandemics end. I am going to quote you now on a regular basis.
You can bet the farm on it. That will end.
I will. Thank you. So thank you for your kind comments as well. As far, you mentioned that you've been planning since August of last year around this. Obviously, these initiatives take time to organize and to think of everything. I'm sure that you would understand the public's disappointment when we've heard recently about the delay in the vaccine delivery. That was tough. I think there was such great hope. And then I'm sure it was tough for all of us to hear. But you're saying keep hope that we will get the vaccines. It just may be slightly delayed.
It's definitely a matter of time. It's worth mentioning when we start planning in August, it was completed in September. When the first vaccine was approved with the requirement of temperature of -75 and you cannot move it. So you cannot really send it to the family physician to administer to their patient. That's a new challenge. And the planning since then has been completed. We're ready to implement. The only bottleneck is the only hold is the vaccine arriving. And as soon as it arrives, we can utilize it in any quantities it would be.
Yeah, so you're ready. It's just waiting for the supply. Now, as far as, so you've mentioned there are hubs, so there will be vaccine clinics available throughout Grey Bruce, correct?
Correct.
Yeah.
In long-term care, we deliver the service where they need it. Right. We hope with the Pfizer vaccine, there's more flexibility with moving it within a period of time. Carol, when we send a vaccine to a family physician, it can stay in their fridge for a month, so they can vaccinate people as they come. This vaccine is not stable, so it has to be used within 6 hours, and that makes the logistics, if we bring people to where the vaccine is more appropriate and less wastage of vaccine. However, in a few weeks, we might get more vaccines that could be transferred, and that's where we would utilize all partners. So the distribution, if we look at the first plan, which many people can relate to, it's very similar to the flu vaccine. In October and November, we vaccinated over 40,000 people in Grey Bruce effortlessly. Yes, people didn't get the vaccine on the same day, but it within a couple of weeks. Mm-hmm. So that would be the first plan, and will support many people in the two counties. Nevertheless, if we get the Pfizer vaccine, we need those hubs. If we get plenty of any vaccine, we need a hub. And those hubs are similar to production line approach. So instead of going into a clinic and waiting, then moving to a different clinic to get the vaccine, or a room, then go back and wait and recover, it will be free flow and organized. And again, you can tell probably from my face, I'm excited about that part. I'm sure when it's going to be shared with the public very soon, it's going to impress.
Excellent. Excellent. Would you mind speaking a little bit about the timing of the second dose? Because that certainly has been a conversation point regarding the vaccines. What are your plans for the second injection for those vaccines that require two?
Right. So with the Pfizer vaccine, there should be 21 days between the first dose and the second dose to get the efficacy according to the clinical trials. And very recently, NACI is the National Advisory Committee for Immunization, recommended or allowed to extend that period of time to 42 days. So that gives us a bit more flexibility with the supply of vaccine. The communication with the general, we meet with him every 2 days, is clear. The second dose will be there. Don't worry about it. As soon as you get vaccine, use it. So in the coming few weeks, I believe we're going to get the vaccines that are needed to support that second dose, and hopefully more vaccine to actually provide first dose to other people.
Okay. So your recommendation to people is make sure you get that second dose.
Definitely. The first dose, the body will build immunity within 2 weeks or so, but not everybody who got the vaccine will get that immunity. It's around 52%, the number from the clinical trials, will get the immunity. With second dose, that percentage goes up to 94%. And the time interval is usually timed by us, and we'll remind people when they need it. And so far with long-term care, it's straightforward because we go to the facility and everybody's ready. When we get to the hub or clinic, there will be more reminders and ways to get the dose they need.
Yeah, so that's critical for people to be aware that they do need to go and get that second to really be sure that they continue to protect themselves and the community, because we want people to have the maximum benefit from the vaccine that they possibly can get. So we have a few other topics that we had before the program thought if we had time we could touch on them. Is there one that you'd like to address next out of the list? There was certainly the school restart to talk about that, case management and whether the health unit has the resources to continue with case management. And then just a word about the Amish communities.
Certainly, I'll do my best to touch base on 3 of them, or at least 2. The first one is the school one. We had a discussion with the chief MOH this week, and we have regular meetings. The subject was school and readiness in Grey Bruce, and the data here definitely support that. For the past few days, we had an average of 2-3. That's the baseline where we started, so it's quite manageable. It's important to all of us to remember that just because we're opening schools for our kids does not mean that the stay-at-home order does not exist. Actually, it's very consistent, both recommendation. Going to school is an essential task, activity that's needed for our kids, and we need to do our best in every other activity to reduce the risk to allow for this activity to continue. And it's not that because they met their friends there, they can meet them after hours. Risk is cumulative. So we took calculated risk with that controlled environment. Meeting outside school is not the same risk. It's actually way more risk. And I trust from working with the community for the past 10 months, I have the full confidence that Grey Bruce will continue to have that safe environment in schools. Our colleagues in schools, the school workers, teachers, are doing an amazing job to keep it safe. The parents, the students, everybody's doing their part, and I have no doubt we'll continue to do that going forward. With the second subject or the third subject, the Low German speaking communities, Amish and Mennonite, for the past few days and for the past couple of months, it's easy for some people, for some of us, or any one of us, to realize that we're in a hardship, and pointing a finger might make some sense. to somebody at some point just to reduce their anxiety or their hardship. But truly, the hardship is the pandemic. It's not the others, whomever these others are. It's not the decision maker who's managing the emergency. It's not the professional giving them the advice. It's not the visitor to Grey Bruce. It is not the Amish and Mennonite. We have solid data from the past 4 months. People who got sick in Grey Bruce got it from their family and friends. The fact that somebody might have less compliance with the recommendation or not might increase their own risk, but not the risk of people around them. And truly firsthand working with the majority of the communities, the Amish and Mennonite, today and last night, I got calls from leaders of these communities saying, let us know what happens. We need to be compliant. We need to be respectful of our neighbors. We realize, it's God's wish, that's God's will, sorry, that there is a pandemic, and they have that faith approach to acceptance. But that doesn't mean really they're reluctant to protect people around them. And again, firsthand, I attest to it. They're doing their best. There was a specific issue that was mentioned a few times, which is a church gathering on church days. Many people see the buggies or the carts in the church parking lot, and they assume that this is a gathering. It's actually with consultation from the leaders with our health unit to ensure it's done drive-through church according to the provincial regulation. People will stay there within their buggies. It's no difference in risk than going to a big box store, picking up a curbside pickup. Staying within the car is not risk to anybody around them. So again, reminding people that hardships create the inclination to point finger, but that's not a solution to anybody. It actually augments the problem. We need to be kind. We need to be considerate, and in emergencies more so. And that's what really kept us going so far with the good results that we have. And contact management and tracing, that's the last point, Carol, that you mentioned. Some health units have made the hard decision to abandon contact tracing in their areas unless it is in a long-term care or related to high-risk institution. So what that means to us in Grey Bruce, where we continue to have that service, we're not going to be getting notification from these health units that their residents spend some time in Grey Bruce, visited with our residents, or our residents were in those visiting these people at some point if they did. So it's important if somebody knows that their cousin, their family member is diagnosed and they had spent some time, not to wait for us to call them. Please call the COVID line. Our website is there, and we have all the information and the ability to connect with them, evaluate their risk. They don't need to run to the assessment center on their own. That's not going to add benefits, and sometimes can cause harm if they test outside of the window. So all these things are very important for all of us, and I really appreciate the opportunity to share it with our audience. Thank you.
Thank you. Dr. Arra, it's always a pleasure to speak to you. Thank you for your timely information and the news releases you provide to our community so we can go forward with confidence. Thank you so much for being here. And thank you to our viewing audience for joining us today. Please join us again to learn more about resources, services, and programs available to you. Take care. Stay safe. Thank you.